Good evening, viewers. Hope all of you are doing truly well and are trying to stay as safe as possible as we are going through these troubled times, yet are definitely going to come out as winners. We are here today, it's Monday, and we are running this exciting, humorous series of Vyakti and Valli or personalities and peculiarities in diabetes with Dr. Anil Bhoraskar. We are here today. I would like to give you an introduction of the online health channel which we run, which is True Wealth. True Wealth online health channel is an initiative of True Wealth Integrative Healthcare, which provides integrative and personalized health and nutrition advice to guide patients and healthy individuals to overcome their health concerns and manage self health to reach the ultimate goal of holistic health and happiness. True Wealth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. It, of course, also desires to unleash the therapeutic role and potential of nutrition in curing and preventing diseases of today. And we, of course, are realizing the importance of that. A quick note that this live program is, of course, created and a lot of effort has been taken in making it, but this is organized for education and spreading awareness to reach the ultimate goal of health and happiness. However, to understand that the knowledge and experiences shared by the speaker and other participants cannot be treated as consultation. Every individual is different and hence needs an integrative personalized consultation to prevent or cure ailments. So for the same, you can all call us on 98200 or visit our website www.truewealth.in, which you can actually see on this slide. You can also send in your questions and concerns to us, and we're sure that we will do more than justice to it. We will, of course, not be providing any COVID 19 related treatment advice on this program. Having said that, I want to tell you a little bit, of course, about this series which we are running out here after the huge success of True Wealth's first season in personalities and peculiarities, and what we popularly know as Vyakti and Valli, impact on diabetes with Dr. Anil Bhoraskar. We're actually here trying to replay the episode 2 because there is a lot of popular demand on our several different channels where we have actually put this. A lot of us know that we are what we got in gift from our ancestors which are our genes. But in addition, we're also really what we eat and what our environment is. Our environment and upbringing shapes our personalities and gives rise to peculiar behavioral characteristics. These behaviors influence what we eat and what physical activities we do. Globally, diabetes epidemic is observed to be a result of unhealthy lifestyle and dietary patterns as they are shown to greatly influence development of insulin resistance in the body and loss in insulin production by directly or indirectly causing damage to the beta cells producing insulin. The estimate of the actual number of diabetics in India is around 40 million, making India the diabetes capital of the world. Also, these days, diabetes is found in individuals much earlier in life, meaning that chronic long-term complications are becoming more common. Dr. Anil Bhoraskar, who is one of the most renowned diabetologists from India, has been studying personalities and peculiar behavioral characteristics in his diabetes practice for over 4 decades, which has really greatly enhanced his diabetes management outcomes. Along with being a key opinion leader in diabetes, Dr. Anil Bhoraskar is even actually a more intense humorist. He has a collection of character sketches of real life people who he has treated and related incidences which he has written about and intends to narrate the same in a series of super laughter episodes for all of us to enjoy and learn from. Humor is known to improve lifestyle diseases like diabetes, hypertension, depression, obesity, and more. True Wealth Integrative Healthcare is privileged to facilitate this series of serious humor, what I call, for understanding diabetes and managing well with it with Dr. Anil Bhoraskar. A little bit more about Dr. Anil Bhoraskar. He is MD from the Grand Medical College, Mumbai, and he has been recently awarded the fellowship of Royal College of London. He has many papers and publications to his name in national and international journals and has organized and participated in numerous symposiums, seminars, and conferences. Dr. Anil Bhoraskar has been practicing diabetology for almost 4 decades at various institutions, including KM Hospital, SL Raheja Hospital, Asian Heart Institute, and Asian Cancer Institute. He has been the chair with the International Diabetes Federation up to year 2018 and the secretary of the Diabetic Association of India Scientific Section. While he has globetrotted, he has traveled to the nook and corners of smaller towns and villages, along with cities in India, conducting over thousands of patient education programs, workshops, and camps. He has treated lakhs of patients from across the country with diligence. We are fortunate to be able to pick his pearls of wisdom and present them in front of you, with he himself actually enacting it out. And we believe this series will benefit both the patients and doctors in not only managing diabetes, but also in strengthening their interpersonal understanding. So, presenting to you personalities and peculiarities impact on diabetes, drawing an analogy from Vyakti and Valli in diabetes with Dr. Anil Bhoraskar. Out of his collection of character sketches, today Dr. Anil Bhoraskar illustrates the personality Mr. Avirat Salkar, who is suffering from hypochondriasis, which is an illness, anxiety disorder, apart from his uncontrolled diabetes. So presenting to you.
Okay, friends, I think in this episode, we are going to discuss a peculiarity of a particular person who is never satisfied with one doctor. And I don't blame such people because this is a chronic disease. And people live with this disease for 30, 40 years. And they are always in a search of solace and relief from the symptoms. Many times the sugars are under control, the lipids are under control, the blood pressure is under control, the patient's weight is under control, his complications clinically are not visible. But if you ask that patient, how are you? He says, miserable. My legs are hurting, my joints are paining, my nerves are tingling, I have a numbness, I get dizzy spells, I cannot concentrate. Various terminology, गमतून નથી, मजा નથી, लाईफमध्ये काय मजा नाही डॉक्टर साहेब, सगळं आहे पण सुख नाही. Now this is a problem of diabetes. I agree. But that doesn't mean that a person should look for a search of some magic remedy. Everybody wants a magic remedy. Everybody wants Sanjeevani in his life. Nothing wrong in that. In fact, the medicine progresses because of this attitude of constant search of improvement in existing treatment. That's how the new drugs come. But there are some people, there's one person, Mr. Avirat Salkar, he is a prototype of such people. The first time Avirat came to my clinic, he came with 2 briefcases, full briefcases, medium sized briefcases, and one person was carrying them. He came in my chambers. असे हे काय, हे माझे पहिले डॉक्टरांचे रेकॉर्ड्स. म्हटले किती आहेत? आत्तापर्यंत 16 डॉक्टर झाले, तुम्ही 17वे. And I want you to go through my reports and I want you to go through my history. So 16 files, I had no patience. And I'm senior enough to tell him bluntly that, look here, I have no time to read this. By now you must have made a small synopsis of your symptoms and the treatment you have received so far. He said, yes, te mi lihun आणले. Of course, that also ran into 4 pages. Fair enough. So I went through it. First doctor that he consulted was in 1994. And the doctor, I know his name, reputation, is a very competent, very knowledgeable, very much painstaking, very ethical. Actually, he's a friend of mine. And he gave, I think at that time, with that particular lipid levels and sugar, he gave absolutely perfect treatment. And his sugars were normal after that. Then I said, why did you leave this doctor? This doctor has been treating you well. नाही साहेब, 2-3 वर्ष त्यांनी तीच मला ट्रीटमेंट दिली. काय मग काय मजा नाही ना. म्हटलं मजा काय, मजेचा अर्थ काय? हे तो काय डॉक्टर तुम्हाला डान्स करून दाखवणार तिकडे, की तो काय नकला करणार? म्हणजे मजा काय? ही हॅज गिव्हन यू करेक्ट ट्रीटमेंट, तुम्हाला बरं वाटतं, पॅरामीटर्स आर नॉर्मल. नाही, पण डॉक्टरचा स्वभाव कोऑपरेटिव्ह नाही त्याचा. म्हणजे कोऑपरेटिव्ह म्हणजे काय करावं, तुम्ही काय पापा घ्यायला पाहिजे त्यांनी? कोऑपरेटिव्ह राहायचा अर्थ काय? नाही, ते फार कमी बोलतात. म्हटलं काही डॉक्टर लोक कमी बोलतात, पण त्यांच्या हाताला गुण असतो. नाही, आम्हाला असं काय सगळ्याच गोष्टी एक्सप्लेन करून सांगत नाही नीट, म्हणून मी त्यांना सोडलं. मग नंतरचे 2 डॉक्टर, त्यांच्याविषयी इतकं पेपरामध्ये लिहून आणलं आणि मी त्यांचं आर्टिकल वाचले. तर म्हटले हा डॉक्टर आपल्याला पाहिजे. मी त्यांच्याकडे गेलो, त्यांच्याकडे भरी मोठी भीड. मला 1 महिन्यानंतर अपॉइंटमेंट मिळाली. मी हा डॉक्टर नक्कीच चांगला असणार, मोठा असणार. मी थांबलो, 1 महिना वाट पाहिली. मग त्यांनी मला ट्रीटमेंट दिली. ते म्हणाले काय, ह्या डॉक्टरांनी जी ट्रीटमेंट दिली आहे परफेक्ट आहे, त्यांनी ती ट्रीटमेंट चालू ठेवली. हे म्हणजे काय, आम्ही 1 महिना थांबून त्यांना पैसे देऊन तेच काय ट्रीटमेंट, का आम्हाला काय अक्कल नाही काय? म्हटलं ते राहू दे, तुम्हाला अक्कल नाही की आहे हा वेगळा मुद्दा आहे म्हटलं. परंतु त्या डॉक्टरने म्हटलं ती ट्रीटमेंट बरोबर आहे. नाही, पण हे डॉक्टर फार उद्धट वाटले. म्हटलं मग तुम्ही जरा जास्त उद्धट डॉक्टरांची तयारी करून आलात तर माझ्याकडे या म्हटलं. नाही, तसं नाही, आम्ही तुम पेशंट बरं झालेले पाहिले आहेत वगैरे. म्हटलं ठीक आहे. अशा त्यांनी मला 10 फायली दाखवल्या, म्हणजे त्याचं सिनॉप्सिस दाखवले. आणि कुठल्याही डॉक्टरच्या कुठल्याही ट्रीटमेंटला ही वॉज नॉट हॅपी. आणि त्याला विशेष काय होत नव्हतं. मी त्याला तपासलं, ही हॅड माइल्ड न्यूरोपॅथी, ही हॅड माइल्ड चेंज ऑफ प्रेशर इन स्टँडिंग अँड सिटिंग पोझिशन. त्याची ब्लड प्रेशरची ट्रीटमेंट थोडी जरा ॲग्रेसिव्ह चालली होती. ती मी ॲडजस्ट करून मला वाटलं की त्याची जी सिम्पटम्स आहेत, उभा राहिल्यानंतर थोडंसं गरगरल्यासारखं वाटणं वगैरे, हे बरे होतील. पायाच्या त्याच्या नसा खराब होत्याच, त्याला काय उपाय नाही. त्याला म्हटलं हे तुमचे जे पायाचे काय आहे, हे तुमच्या दुधाचं दही झालेलं आहे, त्याला परत दूध करणं शक्य नाही. आणि तुम्ही किती औषध घेतली, किती गोळ्या खाल्ल्या, काही केलं तरी ते तुम्हाला परत नॉर्मल करणं कठीण आहे. तुमचे इमिजिएट जे सिम्पटम्स आहेत ते जातील, क्रॅम्प्स येणं, हे होणं. नाही म्हणजे हे आमचं ते काय तुमचं न्यूरोपॅथी काय बरं होणार नाही काय, आम्ही एवढं इन्शुलिन वगैरे घेऊन? म्हटलं न्यूरोपॅथी पटकन बरी होत नाही. त्याची तुम्ही तयारी ठेवा. तो कसा तरी पटला, माझी औषध घेतली. मला वाटलं आज बहुतेक माझ्याकडे येणार नाही. 2 महिन्यांनी परत आला. या 2 महिन्यात त्याला वेगळ्या वेगळ्या तक्रारी, त्याच्या शरीरामध्ये जेवढे ऑर्गन्स आहेत प्रत्येक ऑर्गनचं काही ना काहीतरी त्याला जे पुस्तकात दिलेलं आहे ती त्याला लक्षणं होत होती. डॉक्टर ते गॅस्ट्रोपेरिसिस म्हणून काय असतं ना, ते काहीतरी असं पोट हळू असं एमटी होणं आणि खाल्लं वरचा घास वरती, खालचा घास खालती आणि गॅस असा अटकला होता बिंबीच्या जवळ, असं मला 2 महिने झालं. तर मग तुम्ही फार बिझी असता, मग आम्ही 4थ्या डॉक्टर म्हणजे हा 18वा डॉक्टर म्हटलं हां त्यांच्याकडे गेलो. मग ते काय म्हणाले, तर ते म्हणाले की तुम्ही हे च्यवनप्राश घ्या. आणि ते च्यवनप्राश त्यांच्या आजोबाने केलेलं आहे घरी, म्हणजे त्यांचं प्रायव्हेट. त्याला काय म्हटलं ट्रेड नेम नाही, काय नाही, त्याला FDA अप्रुव्हल नाही, काय नाही. त्याला काही चाटण दिलं. ते चाटण 2-4 दिवस खाल्लं, ते खूप बरं वाटलं. मग एक दिवस ते चाटणचा डबा उघडा राहिला कपाटात आणि सगळी झुरळ मरून गेली. मला वाटलं हे काय भयंकर औषध, म्हणून बंद केलं. त्या डॉक्टरकडे जायचं बंद झालं. म्हटलं तुम्ही हे असं का केलं, ह्याला कुठलंही स्टँडर्ड FDA नाही अप्रुव्हल, हे कुठल्या फार्माकोपियामध्ये औषध नाही, ते तुम्ही का घेतलं. मग ह्याची साईड इफेक्ट झाले तर कोण जबाबदार, आणि तुम्ही त्या डॉक्टरला जबाबदार करणार नाही. पण त्यांनी ते च्यवनप्राश दिलं, मला 2-3 दिवस बरं वाटलं. म्हटलं एक गंमत आहे, कुठल्याही डायबिटिक पेशंटला कुठल्याही काहीतरी वस्तू दिली तर 2-3 दिवस आराम वाटतो, कारण तो इथे असतो डिफेक्ट, पोटात नसतो. आणि खाण्याच्या वेळा वगैरे सगळं तंत्र पाळलं की होणार नाही काही. हां मलाही वाटलं नंतर, मला काही ठराविक गोष्टी, त्या दिवशी थोडे दिवस मी शेव खाल्ली आणि भजी खाल्ली, त्याच्यामुळे असेल म्हणजे त्याच्यामुळेच झालं आहे. हे तुम्हाला पोटाचा विकार नाही, गॅस्ट्रोपेरिसिस वगैरे काय नाही तुम्हाला. हो बरोबर ते. पण डॉक्टर आता गुडघ्याखालच्या ज्या नसा आहेत ना, त्याचं काहीतरी तुम्ही करा. म्हटलं मी त्याला काही औषध दिली 2-4, बरं वाटेल त्याला म्हणून. मला माहिती होतं त्याला काही विषय फायदा होणार. 1 महिन्यानंतर, आफ्टर 1 month, this man comes again. This time looking very serious. He says, there is one person who has suggested me acupuncture for lower limb neuropathy. Now listen to me. I am not qualified to comment on it because I have no knowledge or experience about acupressure or acupuncture. I don't say that this science is humbug because it is a great science, but I have no study of this science. So I cannot recommend it and I cannot advise it. नाही, पण असं कसं डायबिटीसवरती आहे ते, तुम्हाला माहिती पाहिजे त्याची. म्हटलं मला आहे, मी करू. आता तुम्ही येऊन गेलो आफ्टर युअर, आय ट्राय टू रीड अप लिटल बिट समवेअर देअर अँड देअर, होपिंग दॅट ही विल नॉट कम बॅक टू मी अगेन. 1 month later, this gentleman comes with an abscess in both the legs at a site where somebody had done so-called acupuncture. Now, this abscess was an early abscess. It was not a serious abscess as a foot abscess. One word, foot abscess is a serious matter. This was in a calf area. So I said, this needs antibiotics. This needs complete bed rest. It doesn't need any, it needs immobilization and regular dressing, for which it is advisable that you either stay in a good hospital where we'll take a good care of you and you'll feel better. Sure enough, he got agreed to that and got admitted under my care. And we looked after his dressing and everything and sugar control, and he was all right, absolutely. Now what happened, that was a mistake on my part, not realizing this man's personality, his gait of getting attracted by other people's. Now he was admitted in a general ward. In general ward there are 12 patients. He had enough time to discuss all these 12 patients, their problems. All the 12 people have different problems for which they were admitted. And they were chatting with each other, and this man, after discharge, had symptoms of all those 12 patients. He says, Doctor, you have not examined my retina. But your retina, full examination we did last year. There is nothing wrong with your retina. No, but I want to see what is my macula. What is the macular accuracy, acuity, whether it is determined. हे तुम्हाला कोणी सांगितलं सगळं? नाही, there was a chap sitting next to me. म्हटलं, he's a high myopic. Luckily that fellow was my patient. He's a high myopic. The number -11 आहे and developed because of macular degeneration, developed because of high myopia. No, but माझा पण नंबर आहे. म्हटलं, तुम्हाला नंबर 1 आहे आणि दुसऱ्या डोळ्याला 1.5 आहे. This is not myopia. She said, but you dilate my eye. I refer him to a very competent ophthalmologist. And the ophthalmologist said, there's nothing wrong. Luckily, he's got no even background retinopathy. So he said, म्हणजे काय काहीच नाही मला. म्हटलं, तुम्हाला काय हवं आहे का काही? नाही, मग माझी ते एकदा ते पायाचं झालं, मला अँजिओग्राफी करायची पायाची. म्हटलं, कशाला? तुम्हाला काय होतं आहे का? नाही, पाय बी दुखत आहे. तुम्ही त्या नंबरचा पेशंट, तो माझा पेशंट होता, दुसरा होता. दॅट पेशंट, you done his angiography and you found a block and they did a plastic and now he's all right. So I think I need to undergo bilateral angiography. But look here, you have no indication. Your dorsalis pedis, the last artery of the leg, is also palpable, thumping. Where is the question of doing your arterial study? It is not desirable. It has got its own complications. Why do you want to do it? No, I am not well. The leg are paining. In fact, my leg is becoming narrower. What are you talking? I am measuring the girth of my calf and my thighs every day. And every day it is coming by 1 millimeter. But who has asked you to do this? And who is measuring it? And my wife sits up. म्हटलं, तुम्हाला दुसरे उद्योग नाही की एक दुसरे पायचे काय मोजताय बसून तर तुम्हाला नाही पण माझं अँजिओग्राफी करा. I said, okay. I asked my vascular surgeon and asked him, Baba, what is your opinion? Vascular surgeon, being a very ethical person, our hospital, we have such people only. They won't do anything unnecessary just for the sake of money. He says, he wrote it down, patient does not need angiography. Black and white. He was very disappointed. He was very disappointed with our services. He was very disappointed, very, very disappointed in our attitude towards patient management. And he wrote a very big letter to our medical superintendent that your doctors are careless, they are negligent, they have no concern for the patient suffering, they are half knowledge, and all that thing. Of course, the chief of the hospital is a very wise man. He understood that the person who is writing this, but he said, you must answer this. It's not that. So I read that letter. I had to show this to a lawyer. A lawyer said, this man is an idiot. Do you want to enter into any conversation or correspondence with him? I said, no. As the luck would have it, third day after I received that letter, he comes to my clinic and he touches my feet. असे काय ना डॉक्टर साहेब माफ करा मला मी ते फ्रस्ट्रेशनमध्ये लिहिलं होतं लेटर ते मी लेटर परत घेतो म्हणजे परत घ्यायचं वगैरे आमच्या हॉस्पिटलमध्ये नसतं आम्ही ते जिथे त्याची विल्हेवाट लावायची लावले आणि तुम्ही पण याचं काय करू नका काय तुम्हाला काय त्रास होतो तर मला कळलेलं आहे ते पण तुम्ही काहीच बरं करत नाही मला आता तुम्ही माझी 17वे-18वे डॉक्टर झालात म्हटलं तुमचे पहिले 16 डॉक्टर ऑल्सो दे हॅव ट्रीटेड यू व्हेरी वेल दे हॅव नॉट गिवन यू रॉंग ट्रीटमेंट इट इज दॅट बिकॉज वी कॅनॉट सॅटिस्फाय यू and you are not at all satisfied that you don't have any complication, your HbA1c is 6.5, you have no proteinuria, you have no documented evidence of callosities of the leg or ulcers, you have no retinopathy, you have no cardiac abnormalities, you should be happy that the very conservative treatment given to you has made you all right for last 20 years, you have not progressed into any complication. No, but डॉक्टर काय आम्हाला काय बरं वाटलं नाही. Now obviously I am smart enough to realize that this man has got subconscious depression. You must know that 20 to 25% patients are for some reason or other depressed either due to diabetes or due to so many other factors in their life, including social reasons, financial reasons, family reasons. And one need to treat that depression. So I told him, look here, I am giving you a wonderful drug. which will treat all the problem. What is it? I said, I'm giving you this drug, which is an antidepressant. And I told him that this drug, I knew that he will read up about it and say that हे वेड्या लोकांना त्याचं औषध. इट्स नॉट वेड्या लोकांसाठी नाही, शहाण्याला आणखीन शहाणं करायचं औषध आहे ते. हां हां हे बरं आहे. पण ते डिप्रेशनच्या गोळ्या म्हटलं ते तुम्हाला थोडंसं, मला डिप्रेशन, मी योगी पुरुष आहे, मी अत्यंत विलपॉवरचा मनुष्य आहे, मला मला होणं शक्यच नाही, पण मला हे डॉक्टर लोकांनी काय बरोबर ट्रीटमेंट दिलेली नाही. म्हटलं नाही तुम्ही हे गोळी घेऊन बघा. आफ्टर 8 days all his symptoms went down. So he had depression. So this sulker fellow will always remember that patients who are seeing many doctors for the want of relief from various symptoms of diabetes eventually have three problems. One is depression. Second is denial. Denial is a very big problem. They deny that they have diabetes. And a third is early dementia. Now, what is this early dementia? Sulker's cognitive functions were normal. His intelligence in his work was too good. He had no major problem except that he complained about one thing which worried me. Now, doctor, मी सकाळी ज्या गोळ्या घेतल्या, इन्शुलिन घेतलं की नाही हे माझ्या लक्षात नसतो. So I said, this is serious. If you have taken insulin and you don't remember having taken it, and by any chance you take it again, it can be a disaster. Matlab, whenever you get a doubt that you have not taken insulin, do not take it that day. Do not take extra dose because that can be harmful. And it so happened that he did that one day. 20 units of insulin he was on. He took 20 units more. His sugar went down. Luckily, he was managed at home with the sugar. But he had such a horrible experience. There, he again comes back to me. Doctor, हे इन्शुलिन जे आहे हे तुम्ही FDA कडे जाऊन ॲनलाइज करा. I think it is spurious. Again, you have to have some faith in system. You cannot doubt every system. You have doubted 18 good doctors earlier and you are stuck to me because of my bad luck, I said. And you are now doubting the credibility of this insulin. This is a pharmaceutical company which is a worldwide famous company. You cannot doubt the quality of the product. Now, I think there is something wrong. By mistake, they have given me high potency insulin. एक वेळ पोटन्सी कमी असलेलं होऊ शकतं बिकॉज ऑफ किपिंग नॉट इन कूल टेम्परेचर, बट नो ड्रग पोटन्सी विल इन्क्रीज. मग कदाचित आय हॅव माइट हॅव टेकन अन एक्स्ट्रा डोज. म्हटलं दॅट इज नॉट कदाचित, दॅट इज 100%. आता सल्कर कीप्स ऑन गेटिंग इन टू व्हेरियस ट्रबल्स लाईक दिस, बट लकीली फॉर हिम अँड अनलकीली फॉर मी, ही कीप्स ऑन कमिंग टू मी. I would be very happy if he goes to another person, another better opinion. But what has happened, I have become senior enough, so all the garbage comes to me and I am dumped with such a patient. They feel this is the final stage and they stuck to me. However, we have to tell them that there is nothing wrong with you. You are fine, all your parameters are normal, and you just need to continue this. Continuous change of treatment is a pharmaceutical company driven propaganda. Lot of people fall prey to it. That this drug which was controlling your diabetes all these years so well, now better drug has come which is told to the physicians, and physicians put it in practice, and patients feel that how come this doctor is still stuck to the old drugs and not giving me the new drugs. Please remember one thing, all new things are not better, and old need not be thrown out. Sometimes old is gold. We need to tell a patient that this drug has been given to you last 20 years and it has been effectively working. Now doctor, bodyला immunity येते, bodyला सवय होते त्याची, body gets used to the drug. But that is to a certain extent true. But in your case, the pancreas is responding very well to this drug. There is no beta cell failure. You are responding to this drug, so don't change it. So this is about Mr. Selkar. And that's why such patients need a great deal of counseling, support structure, building up their confidence, and giving them repeated doses of correct attitude changing. I've been successfully doing this by only analyzing their personality, that why they are not getting relief, whether the problem is really with the system or problem with the mind. The moment you analyze it objectively, you have a solution and patient gets relief. Thank you.
True Wealth Integrative Healthcare believes that nutrition has the power to cure, viewers, we thank all of you for being here as always and trying to encourage us today. There were people in large numbers again, and we would like to thank Dr. Anil Bhoraskar to once again letting us play his episode on Vyakti and Valli. And it was such a great learning out of this episode for all of us. I would like to thank all of you for being here, and we will be back on next Monday again with yet another humorous show of Vyakti and Valli, or what we understand in English is personalities and peculiarities impact on diabetes.